Hi everyone. In this video, we're going to be talking about touch times. If you're not familiar with this term, this is the standard of care for babies in the NBU. It's a scheduled time to perform patient care. So another way of saying that is you're just bundling all the care that you need to do for your baby at one time. It occurs every 3 hours during the day and night duty. So some example schedules of touch times are at 9, 12, 3, and 6, or 10, 1, 4, and 7. Touch times just happen every 3 hours throughout your whole shift. So whenever you're coming on shift, you start your touch time for your first baby, and then your baby ideally sleeps and rests and grows for the next 3 hours, and then you start your touch time again. So every baby has their own set of touch times. If you have a really critically ill baby in the NBU, your touch times might be more frequent, so every hour or every 2 hours. Touch times have a lot of great benefits. So one of them is that it reduces stress on the baby, supports their development, provides more thorough monitoring, which is really important for this hospital because there is not a continuous monitoring system in the NBU. It also increases efficiency throughout your shift, and it promotes family involvement. So touch times have a lot of parts to them. This list might look long and overwhelming, but as a student, it can be helpful to make a checklist of all the things you need to do so that whenever you're starting your touch time, you can check each of these off as you go. You can also see that some of the topics are covered in detail in other videos throughout the whole orientation video as a whole, but we'll touch on them briefly in this presentation. So touch times include vital signs, a head-to-toe assessment, feeding, diaper change, reposition, suctioning as needed, a pain assessment, medications if they're needed, blood work if necessary, and then interactions with the family. So the first thing that you want to do whenever you're starting your touch time is grab a set of vital signs. This is a great baseline for how your patient is doing and how stable they are. So you're probably used to the vital signs that you learn for adults, but for babies, they're very different. They're done at least every 3 hours, but can be more frequent if your baby is really ill. So the first one is pulse rate or heart rate. The normal for babies is 120 to 160 beats per minute. Then SpO2, oxygen saturation, normally is generally between 90 and 100%. Temperature for babies, the normal is 36.5 to 37.5. And then respiratory rate is how many breaths they're taking every minute, and that is 30 to 60 breaths per minute is the normal. So the key thing for you to know as a student is whenever you're taking vital signs, if any of them are out of range or abnormal, you must notify the nurse on duty. So another part of touch times is the head-to-toe assessment, and this is just a brief list of all of the things that you would be looking for during your assessment. If it's helpful to pause on this slide and make some notes, feel free to do that. A really important part of touch times is the feeding. This is covered in detail in another video, but the key points for you to remember as students are that babies must be fed every 3 hours unless they're exclusively breastfeeding, and at that point, they can feed whenever they want. Another key point to remember is that you should never orally feed a baby who is asleep. So by orally, I mean with the syringe, cup, or breastfeeding. So never feed a baby who is asleep. As students in the NBU, you'll be doing diaper changes pretty frequently. So this is also every 3 hours, either before or after the feeding, and you want to invite the mother to change the diaper. So whenever mom is coming in for the feeding time, you want to make sure that she brings all of the supplies that she needs so she doesn't have to walk back and forth between postnatal ward, C-section ward to the NBU. So for the diaper change, she'll need a new diaper, wipes, and possibly a fresh outfit and blanket. So as students, the key things that you want to look for is the diaper dry? So has the baby not urinated since the last time you changed the diaper? Is there any blood noted in the baby's stool? This can mean the the baby might have an infection. This picture shows a little speck of blood in the stool, so it can be really small. And then, is there any skin breakdown? So if you notice any of these things, you want to notify the nurse on duty. Repositioning is very important during your touch time because it prevents pressure injuries. It promotes normal development, especially for the baby's head. It improves their breathing and circulation, enhances digestion, and supports their overall comfort. So there are a few different positions you can do. One is supine, or laying on their back. Prone is laying on their stomach. Left lying and right lying. So every 3 hours, you want to reposition the baby. Suctioning, this is also covered in another video, but the main thing for you to know from this presentation is you should only suction if needed. You don't want to suction every drop of drool that you're seeing from the baby's mouth. You only want to suction if necessary. Pain assessment is very important because babies cannot tell you when they're hurting or they're uncomfortable. So some things that you want to look for is an increased heart rate, lower SpO2. The baby obviously might be crying, have a brow bulge, eyes squeeze, and their behavioral state is overall just inconsolable. So we do a lot of painful procedures to our babies in the NVU. One of them is a needle stick if you're getting a blood glucose. And something interesting is that the most effective intervention for needle stick pain for babies is breastfeeding. So if you know you're going to be getting a lot of blood glucose levels on your baby, you can invite the mom to come sit at the bedside, put the baby to breast, and then do your needle stick. Medications, so this is also covered in another video. But ideally, they're given during the baby's touch time. So for example, given at noon. And that's just to avoid waking the baby in between their touch times. So whenever they're resting and sleeping and growing. However, if the medication needs to be given at a certain time, it should be given regardless of the touch time. Medication should be given by the nurse. And then anytime a medication is being given, you should always double check that you're giving the right medication, right dose, it's to the right patient, the right route. Do all your safety checks whenever you're giving any sort of medication. Blood work is ideally done during the touch time and only if necessary. A key point for you as students to remember is that obtaining blood for babies is very painful. So there are some things that you can do to help alleviate the pain for the baby. One of them is putting a glove on and allowing them to just suck on your finger, and then also swaddling them during the blood draw. And lastly, family interactions. As healthcare professionals, you never want to just start doing things to your patient without first explaining what you're doing and why it's important. So it's really important to involve the mom and family members in the baby's care because it builds a strong relationship, promotes trust between you and the family, and then it provides more patient-centered care. So there's a lot of things that mom can be involved in. The main one is KMC, or skin to skin. She can do the diaper change, give the baby a shower, touch the baby, swaddle the baby, and then help reposition her baby. You really want to empower the mother to take care of her baby. So again, these are all the points of a touch time. And I hope that this presentation was helpful, and I'll see you guys in another video.